In this video we will talk about fibrinogen deficiency, also known as factor 1 deficiency. It is a very rare inherited disorder that affects men and women in equal numbers. It can cause serious bleeding or thrombosis, but the complications vary depending on the severity of the disorder. Almost 100 years ago, in 1920, two smart men named Fritz and Eugene were the first to discover fibrinogen deficiency. They followed a 9-year-old boy who had unexplained bleeding problems from birth and eventually found out that he didn't have any fibrinogen. So first of all, it is important to understand the function of fibrinogen. This is Hans. Hans is cutting carrots for dinner. Suddenly the bell rings, and in a moment of unpaid attention he cuts himself in the finger. Now in his wound many things are happening to stop the bleeding and form a clot. An important factor in this process is the formation of fibrinogen to fibrin, which is necessary to form a clot. In fibrinogen deficiency, there is less or even no fibrinogen, which results in less or no fibrin and a more difficult clot formation. When someone is expected for having a fibrinogen deficiency, this often already becomes clear directly after birth because of umbilical cord bleedings. A blood sample will be taken and sent to the laboratory to perform further testing. Furthermore, family history will be investigated to see whether there have been more bleeding problems. There are 3 different types of fibrinogen deficiency. So let's start with the first one, a complete absence of fibrinogen, or afibrinogenemia. In this condition, there is so little fibrinogen that we could therefore speak of a complete absence of fibrinogen. It occurs in 5 out of 10 million people, which illustrates that this condition is quite rare. Of the 3 types, this one causes the most serious bleedings: umbilical cord bleedings, intracranial bleedings, bruises, gum bleedings, nose bleedings, gastrointestinal hemorrhage, and more other types are common bleedings that occur with this condition. Afibrinogenemia is inherited recessively, which means that both your parents should carry the trait. This does, however, not mean that both parents should be affected by the condition. As the problem here is that there is no fibrinogen, the solution looks simple. Treatment consists of intravenously adding fibrinogen or blood plasma. The second form of fibrinogen deficiency, hypofibrinogenemia, involves a lowered amount of fibrinogen. So fibrinogen is present, but less than normal. This condition does occur even less than afibrinogenemia, which makes hypofibrinogenemia a very rare condition. Symptoms are similar to afibrinogenemia. However, the severity depends on the amount of fibrinogen present. The higher the fibrinogen level, the less bleeding. The lower the fibrinogen level, the more bleeding. Hypofibrinogenemia can be inherited dominantly or recessively. In case of a dominant inheritance, one of the parents is affected by the condition. In case of recessive inheritance, both parents carry a gene for the condition, but they don't have symptoms, as in afibrinogenemia. Like in afibrinogenemia, the treatment consists of intravenously adding fibrinogen or blood plasma. Depending on the severity, it will be decided whether it is really necessary to add fibrinogen or not. Next to a complete absence of fibrinogen and a lowered amount of fibrinogen, there is also dysfibrinogenemia. This means that you actually have fibrinogen. However, it does not function properly. 1 in a million people suffer from this condition, which makes it from the 3 fibrinogen deficiencies the most common. Symptoms are divergent. Patients might show bleedings, but also thrombosis, which is at the other side of the spectrum. 53% shows no symptoms, 26% show bleeding tendency, and 21% show thrombosis tendency. Dysfibrinogenemia is inherited dominantly. This means that if one of your parents suffers from this condition, there is a 50% chance that the child will suffer from it as well. As dysfibrinogenemia expresses itself a little different than the other 2 conditions, treatment depends on the symptoms presented and its severity. In case of bleeding, blood plasma is intravenously added to the blood. In case of thrombosis, anticoagulation medication will be given. So let's zoom out again. There are a few situations in which patients with a fibrinogen deficiency should be more careful. First of all, it is important to prevent dental problems by having regular checkups every 6 months. If, however, you will be in a situation in which you will be needing surgery, it is important to contact your physician in order to plan adequate preventive treatment. Moreover, women with afibrinogenemia have an increased risk of miscarriage between the 5th and 8th week of pregnancy. Therefore, it is essential to start adding fibrinogen from the 4th week of pregnancy. In addition, to prevent placental detachment, it is necessary to keep the fibrinogen level up. Bleeding after childbirth is usually controlled with a lower dose of fibrinogen. This treatment is also recommended in hypofibrinogenemia, depending on the level of fibrinogen in the blood. The higher the fibrinogen level, the fewer miscarriages. The lower the fibrinogen level, the higher the rate of miscarriages. In dysfibrinogenemia, pregnancy problems vary depending on the severity and type of dysfibrinogenemia. Treatment must be tailored to the situation. Many patients with dysfibrinogenemia may give birth without bleeding, and fibrinogen concentrate is often not necessary.